Hi, my name is Dr. Sahiba Bedi. I'm an ophthalmologist and I'm working at Manubhai Shah Medical and Research Center.
Could you tell us your qualifications and the years of experience that you have?
I have done my MBBS followed by my master's in the field of ophthalmology. After master's, I went on to do two long-term fellowships. One was a 1.5 year long fellowship in cataract surgery and phacoemulsification. This was followed by another long-term fellowship in pediatric ophthalmology and squint management. I have about 8 to 9 years of experience post completion of my master's.
What services do you provide at Manubhai Shah Medical and Research Center?
So we have a very comprehensive eye care OPD at Manubhai Shah Medical and Research Center. This includes managing any eye numbers that patients may have of any age group from zero onwards. Also, we give treatments for cataracts, which is a very common eye care problem, which is also known as motiya in Hindi. Other than that, we treat eye infections, eye allergies, for any reason. If there is a sty or a swelling in the eye, treatment of squint can be possible and certain corneal diseases. And we also check the back part of the eye, which is the retina, which is also known as parda in Hindi, which can get affected in patients with diabetes and blood pressure.
What are the most common eye problems you see among patients today?
Common eye problems that we encounter today are eye infections, like eye flu, which is also known as conjunctivitis, requirement for glasses, which is also known as refractive error. Another common entity is cataract that we see, which is known as motiya or motiya in Hindi, and also retina examinations. So, retina is the back part of the eye, which is also known as anka parda in Hindi. So, in patients with diabetes, blood pressure, etc., they tend to have the back of the eye affected, which is known as diabetic retinopathy. So, that also we check on regular basis at the center.
What are some early signs of eye flu people should not ignore?
Eye flu is extremely contagious, and early signs include redness, watering from the eye, gritty sensation, which means that something's gone in the eye. You feel that you've contracted some foreign body inside the eye, or swelling of the eyelids. These are some of the early signs which may be an eye flu. So, if you have any one or more of these, to contact your nearest ophthalmologist for further intervention.
What precautions would you suggest one should take who has eye flu or conjunctivitis?
Eye flu is definitely contagious. Eye flu is also known as conjunctivitis. So it is contagious, but it spreads through surfaces and dirty hands. So there is a myth that people have, that they feel that if they look into somebody's eye who has a conjunctivitis, they can also contract. It's not like that. You can make an eye contact with a conjunctivitis or an eye flu patient, but from a distance. It is the sharing of objects and surfaces that you need to take care of and prevent from happening. So anybody, if has conjunctivitis or eye flu in your house, or if you yourself have it, make sure that you wash your hands regularly, a lot of times in the day. Keep your eyes clean through use of lid wipes, which are commercially available in the market, or simple boil some cotton in water and use boiled cotton for wiping your eyes regularly, so that whatever discharge or dirt is coming out is frequently cleaned from your eyes. Try not to share objects with other people in the house. For example, simple things like dishes in the kitchen, or your laptops, or your notebooks, or stationery. Try to keep your objects separate, and isolation is the best. If you can contain yourself in a separate room for 3 to 4 days whilst your eye infection is getting treatment, that is the best way to prevent it from getting spread to others in the house.
What's your advice for maintaining good eye health in today's screen heavy lifestyle?
So, yes, definitely the screen use has increased a lot over the last few years. Today's youth, especially 20 to 40 years old, have become very heavily dependent on their laptops and mobiles for work as well as entertainment requirements. So, my advice would be that keep your screen use in moderation. So, near activities, if done excessively, which includes excessive reading, writing, fine work, and computer and mobile usage, tends to have a deleterious effect on the eye health. So, if you think you cannot reduce your screen time much because of your work related commitments, then a good idea is to take frequent breaks in between. So, the ideal rule is 20-20-20. That is, after every 20 minutes, you should take a break for 20 seconds and look 20 feet away. So, if you do that regularly throughout the day, then your eyes tend to get less tired by the end of the day. Your productivity increases and you will be able to see and work better. And also take an ophthalmologist's opinion on that, because they can prescribe you some lubricating eye drops which are meant for comfort, because a lot of screen use is associated with dry eyes, so that also tends to harm you a little bit in the long run. So if you can meet an ophthalmologist and get a lubricating drop prescribed for you and use it regularly, that will also help you in the long run to avoid screen related dry eye.
How often should adults and children get their eyes checked?
So, a regular eye checkup is of utmost importance, especially if you are wearing a number. That means if you have a glasses. So, ideally, glasses need to be checked once a year, even if there is no complaint with your previous glasses, because minus numbers and plus numbers specifically, if you are wearing them, they will change as the age progresses. So, especially in smaller children who are growing, they need to have a regular eye checkup once a year. For adults, again, once a year is good enough, because we can always, at a gap of 1 year, check you for any development of cataracts. आपका मोतियाबिंद बढ़ रहा है, stable रह रहा है, we can always guide you on how much can you wait until you need a surgery. And even patients who have diabetes and blood pressure, जैसे कि मैंने बोला, उनका retina checkup is required. So the retina ideally needs to be again checked once a year, even if your diabetes and blood pressure is controlled.
What's the one message you'd like to pass to your audience?
So I would like to say just one or two things is that don't ignore any of your eye symptoms, even if you feel they are very mild. So a simple redness or just watering from the eyes could be something that may need an expert's opinion and management. So at the slightest of any discomfort in your eye, do visit your ophthalmologist for further management of the problem. And even if your eye is not giving you any trouble, you are good to go. Once a year, regular checkup of the eyes should be done, because you may have a small number, you may be getting small, unimportant, frequent headaches, which you may not know why is that happening. It could be just a simple glass prescription that may help alleviate your headache. So keep a regular checkup with your ophthalmologist at least once a year, even if you do not have any persistent eye problems.